Hi everybody, I'm Dr. Andrea Orvieto from SOFLA Acupuncture and Wellness, and today's topic is going to be a bit heavy and it can be triggering to some people as well. And all I'm trying to do is educate and be a source of knowledge and also a place where you can receive support. And today's topic we're going to discuss about miscarriages. And it's not one that, no matter the reason why one miscarries, it doesn't make it any easier to cope with, whether it is a chromosomal issue or not. We still have the right as women and our partners to grieve the loss of our future baby. So in pregnancy, there's between 15 and 20% of them end in miscarriages. And within that percentage, 75% is within the first 12 weeks, which happens to be the reason why a lot of people, a lot of couples tend to keep it a little bit more secretive and to themselves just in case. It's a very vulnerable time and it can be very scary. A lot can happen within those first 12 weeks and some of them we have absolutely no control over. And some, with more recent science and medicine and other alternatives such as acupuncture, we can actually help prevent as well, which actually I can speak from a personal place because in the beginning of my pregnancy had some bleeding and my hormone levels dropped, and my doctor, between supplementing progesterone and acupuncture, it helped get me through that first trimester and help have a successful pregnancy, almost a successful full pregnancy. So recurrent pregnancy loss. So this can happen. Women can have a pregnancy loss randomly. They may have a child, they may have a miscarriage, and then they may have a successful pregnancy. But when it comes to recurrent pregnancy loss, it means that clinically more than 2 of their pregnancies consecutively had ended in a miscarriage. And it can happen in 15 to 20% of pregnancies. And actually, a lot of it can happen even before you know you had a missed period. That's about 30 to 50%, it's something what we call a chemical pregnancy, where you didn't even know that you were pregnant and it was a miscarry. So there are multiple reasons as to why women may miscarry. One can be genetic issues, genetic problems, chromosomal abnormalities. The embryo wasn't viable, wouldn't have made it till gestation, and if it did, we don't know what the circumstances would have been after that. It can be abnormal hormone levels. So it could be your progesterone is dropping or prolactin is too high. And if we catch that, there's a good chance that, or there can be a chance in which the pregnancy can be saved because the embryo is actually completely fine and normal. There could be structural problems, that your uterus is not in the most prime shape and the embryo is having difficulty staying implanted inside of the uterus. There are cervical issues where we call an incompetent cervix, where it's not strong enough to keep closed and to stay closed, and it can cause a miscarry. There can be infections, environmental issues, also blood clotting issues. And if those aren't caught beforehand, it can be a reason why a miscarriage happens. Fortunately, when we have all of this information, there are things and ways to prevent miscarriages. Of course, unless there are abnormal or genetic issues within that embryo in which the body tends to respond and then does its own thing to miscarry because it doesn't see that it's going to be a successful pregnancy. With acupuncture, herbs, diet, supplement, and Western medicine in combination, miscarriages, we have enough information, we have a lot of information around it that we can hopefully prevent them in the future. So if you or you know somebody that has recurrent miscarriages and are uncertain as to why or how to have a successful pregnancy, or may have a lot of fear around having getting pregnant again, please reach out. I'm here to support you. I'm here to educate you and to be a place that there's no judgment as well. So if you have any further questions about miscarriages or anything in that category, please reach out. And I look forward to seeing you in the office.